Okay, so we're going to talk about the ultrasonic, and this is going to take a few separate videos because I need to show you a few separate things for setting this up. For this one, I want to focus just on using the ultrasonic itself as far as with adaptation and use on the tooth. And so you have different parts of your ultrasonic. You're going to have a sterimate. This is what we keep in the sterilization room for you to use each time you use your ultrasonic. And then you're going to have tips. You have an orange tip and a purple tip. Sometimes the colors can change depending on what types of instruments you're using. So the gist of this with these, different brands too, your orange tip in particular is going to be more like a universal tip, where it's thicker. It can be used to remove bigger pieces of calculus. Like you're going to use this on your calculus bridges, things where you've got more going on. And then for this one too, with power, your power is going to be different on your dial. So this power is going to be from medium to high. We definitely start near medium, but if you need to, you can start bumping it up. I have noticed before when working in clinic, students have their power setting on low. And so we'll come in and they can't figure out why this instrument isn't doing what it needs to do and like actually breaking through these big pieces of calculus, but it's because their power is not high enough. So absolutely start at medium, but then don't be afraid to bump up if you have to. For your next one, what you guys in particular have is called a slimline, so the purple one. But no matter what color it is, there's a type of ultrasonic tip that's going to be thinner, and that's what this is. And so I'm going to try and see if I can compare these a little bit. Can you see where that orange one is a little bit thicker than the purple one? And we'll show you in person too, where we've got some better, it's a little bit longer, the purple one is, than the orange one. So it's a skinnier tip. We like this one in particular for whenever we talk about detoxifying tissue and flushing areas out. So maybe this person doesn't have a bunch of calculus, but they need biofilm removal. And I mean, guys, this is even just your class 1 patients. If they've got a little bit of irritation, because what research is showing is that it's important to get that biofilm out of those tissue areas. And so you want to make sure you're doing a really good job to get that out of there. So this is your go-to instrument for that type of work. It can be used for some calculus too, but I definitely always think, biofilm removal with this one in particular. This one's power settings are different. It goes from low to medium. So you start with low, but then if you got pieces of calculus or some stain that you're truly trying to get off, then going to bump your power up some. So don't be afraid to do that. When I think about using low, it's when I'm doing biofilm removal. We don't need to be removing big pieces of things. We are flushing out sulcus and detoxifying. And so you don't need a bunch of power to do that. That water that's spraying out and that action's going to help clean that area out. So that's when I think of low power. I want to show you a few things with adaptation with these instruments before you start using them. When we set them up in the clinic, they're going to work like this. We'll teach you how to fill this up with water. And then once you've got a bubble of water up top, you put your insert in. And then you do have to press it down with a decent amount of pressure to get it to stay in there. And then it clicks down in. So now I'm going to move us over here. What you're going to hear us talking about is channeling. So what you do with an ultrasonic, and I want you paying attention to this tip part. See here, let me move those chairs. You want this tip with channeling to start at the top of the tooth And then you're just going down it like this. And so why I want to show you this without water spraying is I really want you paying attention to that tip and what's actually happening on there. So it's almost like you divide this one in threes too, since it's a bigger tooth. You start up top and you have that end of the tip, or the tip 1/3 that like we've talked about before, on the tooth. And then channeling is just starting at that top and moving side to side the whole way down as it's spraying water. But you want to make sure that you're following the tooth surface, because if you just stay like this and don't adapt to those curves, you're going to be poking into tissue. So what that means is, I mean, that could be uncomfortable for the patient, but you may not even know that, because it's going to be spraying so much water and there's some limited visibility with ultrasonics. So you're not going to necessarily know. And then if you're like this and you don't have the tip 1/3 actually adapted to the tooth, so see how my bend, as I'm up here, my bend is this way, but as I go down, I follow the tooth and my bend tips away from the tooth a little bit. That means my tip's actually doing what it's supposed to be doing. So if you're trying to remove pieces of calculus with that orange one, if your tip's not on there, you're not going to remove it. And so here's channel again. So that's what you do across the direct surfaces of the teeth. And then for the interproximals, you're going to lay it sideways and go up and down like that. Same thing over here, up and down. With this instrument, we don't put the tip directly on the tooth like this, ever. However, when we do use this one, so the orange is going to be used the same way with channeling, where you go up, start up here, go down, and I want to really call your attention to making sure to adapt to those certain parts of the tooth. There is a method called tapping, where if there's a big piece of calculus like this one right here that you just can't get off with your normal channeling, and you see it in there, you can adapt down in there and then use the tip of that instrument on the piece of calculus. So not on the tooth, on the calculus. And you do this. You just keep tapping it until it finally breaks apart and goes away. The other thing about ultrasonics, I think we can get in a false sense of security, thinking as long as we go through all these motions, it's going to do the work for us and just remove everything. And so what I tell students about whenever I talk about ultrasonic myself is that I say that I'm very intentional about ultrasonic. So I don't just like really quickly go through here, you know, you've got to give it time to work, in my opinion. So you need to have your power settings correct, but then you need to go slow enough and methodical enough. Like that's what I always say. I'm very methodical about how I do it. You know, like this, but giving it time to truly remove the pieces that it needs to remove. So you stay down in there for a little bit and let it do its job, rather than skimming across the fronts of things really, really fast, you know, and hoping for the best. Also keep in mind, visibility is going to be tricky with this because it's going to be spraying out lots of water. So this is definitely a time where you need to think about having the patient turn their head side to side to help you. But then there are quite often times where, especially those mandibular anteriors, where I will lift the back of the chair up so that I can see down in there better, just visualizing it. Because once I put my mirror, like if we're using the ultrasonic and I've got a high volume evacuator here, it means I don't have a mirror and I'm spraying water, so it's really hard to see. So I will tip them up so that I can see in that spot better.